More on that now, and thousands more people will receive a COVID-19 vaccine this week as 7 mass injection centres open across England. The government's aiming to vaccinate the over 70s, healthcare workers and those required to shield by mid-February, with the hope that all adults in the UK will be offered a jab by the autumn. Dr. Hilary joins me now to talk through this in more detail. Good morning to you.
Morning, Charlotte.
When we look at the situation we're in then, I mean, you know, there are record hospital admissions. They're really struggling at the moment, aren't they? We've got still a significant number of deaths, which is a worry as well. With these vaccination super hubs opening up today, how much is this going to help? How can they get those vaccinations rolled out as quickly as they need to? We've got the target by mid-February, now suggestions that everyone could be offered, every adult could be offered a jab by autumn.
Yeah, if you've vaccinated those 14 million people by mid-February, that's a major game changer because you've vaccinated the most vulnerable people against COVID-19, the people who account for 4/5 of all deaths with COVID-19. So if we get those vaccinated, and at the moment we've got the volunteers, we've got the hubs, and we've got the vaccines being supplied. So it's really good news. And if we can continue the momentum, then we've really achieved something by mid-February and beyond.
What's happening here, though, with the restrictions? Because are they not working, or is it the fact that people aren't complying? Because there's talk this morning in the newspapers that they're going to have to be tightened, that, you know, we won't be able to go out as often. People have to wear masks out in public, the suggestion is. So what's the worry with the restrictions in place that they are at the moment?
Well, I think it's twofold. Firstly, we've got a variant which is much more transmissible, up to 50 to 70% more transmissible than the virus that we were dealing with this time last year. Last year it was bad enough. Lockdown was effective. It took a few weeks to become effective. And this new variant is more transmissible, and people aren't adhering as much to the rules now as they were then. There's a sort of lockdown fatigue, a bit of complacency. And that's really bad news, because that's why we're seeing so many new cases, 55,000 cases on Friday that were confirmed positive. And that's why hospitals are becoming inundated, ITU departments are full. So we have to be much more disciplined in lockdown right now. And if that means more rules and regulations tightening up, then so be it, because we've got to get through this. It's going to take time for the vaccination rollout to really to make a difference. And remember, it takes another 2 weeks after the second vaccination for your immunity against COVID-19 to be established. So we're a long way away from being out of the woods, really.
Which is worrying, isn't it? And Dr. Hilary, lots of people getting in touch with you the whole time using the hashtag #AskDrHilary when they've got specific questions. And I know we had one on Friday, didn't we? A viewer had a query about the vaccine and breastfeeding, and you've been looking into this for them.
Yeah, no, it's important. The regulations have changed on this in the last few days. So COVID-19 vaccines are not thought to be a risk to the breastfeeding infant. And because of this, the JCVI, the Joint Committee on Vaccination and Immunisation, have stated that it's recommended that the vaccine can be received whilst breastfeeding. Now, in response to my answer on Friday, certainly I heard from groups of people representing lactating mothers who felt that the previous advice from the MHRA, the Medicines and Healthcare Products Regulatory Agency, was over-precautionary and was denying lactating mothers the right to have a vaccination. Not the right, but the advice to have one. So there are about 20,000 women who might be breastfeeding who work in healthcare and social care. And the advice now is this, that there is no known risk of giving these vaccines to breastfeeding women. Breastfeeding women should therefore be offered vaccination if they're eligible otherwise, for example, if they're frontline health and social care workers and work in residential homes. Women should be advised, however, that there is lack of safety data for these specific vaccinations in breastfeeding. They should talk to their healthcare professional before going ahead about the benefit-risk ratio. OK,
Dr. Hilary, thanks very much for now.
Hilary, you see, do we know yet whether actually this lockdown is working? Isn't it too early, one? And if it is too early, are we right to be passing such harsh judgment? I can only do this anecdotally. When I went out at the weekend to my local park, for example, it was pretty quiet and people were pretty well observing the rules. A lot of people were wearing masks as they walked around the park, which I didn't see, actually, in the last lockdown. I just worry, from some of the headlines over the weekend, this big push to blame the public, when actually at the moment we don't know yet, do we? And the observance numbers, the data, don't appear to be massively problematic, unless I'm misreading it.
Well, the R rate is between 1.1 and 1.4, which means that for every 10 people infected, they're going to infect 10 to 14 other people. So that hasn't fallen very much in the first 2 weeks of this lockdown.
Would it have done yet, though?
Well, we know that we asked people to self-isolate, remember, for 2 weeks, having been exposed to someone in close contact with COVID-19. So after 2 weeks, you'd expect people to be clear if they haven't got symptoms.
But when you have a national lockdown like this, how soon after it starts would you expect to start to see a reduction, as we did back in March?
Well, you'd hope to see a reduction within 2 to 3 weeks.
Right. So
it's my point the numbers are very static.
But my point is we haven't reached the 2-week period yet from the start of a lockdown. So is it premature to make judgments about the effectiveness at the moment?
I think what they're doing is looking forward to what could happen in 2 weeks from now. When you look at what's happening in hospitals right now, they're absolutely under huge pressure and turning patients away to go to other hospitals because they've got no beds left. Now, supposing this lockdown isn't quite adequate, then by not doing something more now means...
Are we doing enough, Hilary, in your estimation?
No, we're not.
What would you suggest we should be doing?
Well, what's being mooted right now is that we clamp down on the people flexing. It's been called flexing the rules, bending the rules a little bit, making an excuse to just do this. What is essential? What is essential is going to get food, going to a pharmacy, essential work. Now, not everybody on the road right now is going to do essential work. People are taking...
Sorry, Dr. Hilary, but to intervene, the rule is that you can go to work if you can't work from home. That's slightly different from essential work. You might think people should only be allowed out for essential work, but that's not the rule. Do you think that it should be, as it was in the first lockdown, that only critical workers should be allowed to go to work?
I think we're at that stage now, and I think we need to crack down on people making an excuse to go out and exercise with one other person, because often they'll say, well, no one's going to know if I go out with one person in the morning and one person in the afternoon. Most people, 90% of people, are complying.
But if you're out like those two women in Derby... But Hilary,
adhering to the rules.
Here's one of the problems. You got two different scenes over the weekend.
Yep.
You got two women meeting up. They drove 5 miles to an open parkland.
In Derbyshire.
In Derbyshire. And they walk socially distanced with a cup of coffee each. And they were approached by police and they've been fined £200. Now, I think that's ridiculous. As cyclists have pointed out, are they only allowed to cycle within a 5-mile parameter? That hasn't been set. Most cyclists go a lot further. If they'd cycled there, would anybody be complaining? And what's the problem with two people outside socially distancing, having a cup of coffee? It's not a picnic, as the police said. Now, the reason I'm agitated about that case, compared to what happened when the Tottenham Hotspur team coach arrived yesterday at Marine AFC in Merseyside. Look at the crowds that were gathered. Watch this. Up and down the street there, I understand the Marine AFC supporters' excitement. There were hundreds, if not thousands of people, all crammed in like sardines. Loads of police, nobody arresting anybody or fining anybody. So the public look at this and go, how can that be acceptable? But
it's
two
not.
people driving safely to a parkland and socially distancing with a cup of coffee each is an arrestable, finable offence. That doesn't make any sense.
It doesn't make any sense. The public are quite right to be outraged by that. There's no consistency. It doesn't make sense. And if necessary, they're going to have to ban games. Because if you're going to get that super spreader event, we've just seen in that image, that is nothing else other than a super spreading event, and people might even die as a result of that instance.
Dr. Hilary, what do you think about wearing masks outside? I've noticed more and more people are
They are, yeah.
doing that. And to be honest, It's easier to wear your mask from your front door just in case you're going to pop into a shop.
It's easier not to forget.
And then you
Absolutely.
don't forget
Right,
it.
I actually, that's why I do it more and more,
Yeah.
because I don't want to forget when I go into a shop.
Yeah.
No, it reminds people of the new variant being much more transmissible. It offers protection to those people who are on the receiving end of somebody who might be positive and is wearing a mask. It does offer protection. It reminds people it's safer, and it makes sense to do this. We need everything in our armamentarium right now in preventing transmission of this very nasty new variant.
The truth is, isn't it, there's been two game-changing events that happened towards Christmas. One, the new variant, which is massively faster in transmission. Secondly, the vaccines. And we're now in a race, aren't we, Hilary, between the two? And the sooner that we can get as many vaccinated as possible, and the sooner we can try and suppress the virus in the meantime, that is the game, isn't it, that we have to force through here?
Very much so. We've got to remember that immunity occurs 2 to 3 weeks after that second vaccine, not after the first one. If you want full immunity, or as full as we can get, and reduce hospitalisations and deaths, then it's 2 to 3 weeks after the second vaccination where you can feel a little bit more relaxed about your own personal risk. It's going to take time to do this, and it's likely that because the coronavirus does change its genomic structure, it changes its, we're going to get new variants. It may well be that just like flu vaccine, we're going to need COVID-19 vaccines perhaps on an annual basis. So we're not going to be able to relax for some considerable time. And this idea that, lockdown will finish at a certain date and we'll all be in the clear when vaccinations are done, I think we need to be a little bit
I don't know
more
why the
realistic.
government keep... I don't think there's any point asking them because they don't know the answer. There's no point saying when a restriction is going to end because they don't know.
No, they don't know.
They don't know. We've just got to all do what we can.
No, it's more important to find out when people are going to be vaccinated, because I know there are a huge number of over 80s who are thinking, where's my appointment? And we'll find out from Nadeem Zahawi.
But it has to be said, we're doing well on vaccines. And I will say this to the Minister when we see him. We give them a kicking, quite rightly, over lots of things they've got wrong in this pandemic. We are right up there as one of the best in the world. I think China and America have vaccinated more people. And then I think we're third or fourth, along with the Israelis, who've done a particularly good job.